What's up, everybody? This is Chris from Brooklyn Wildlife, and I have gotten locked out of my Facebook because I posted images where they said it included nudity, even though it was the same photos that I've had on Facebook for years, and they don't include nudity. It was actually an image of one of my friends that recently passed away, and I was just celebrating by showing some of their old photos. But you know how this works. It's always some bullshit. So let me bring on... So I'm going to do it this way. I have a friend who's a medical professional that we will call Dr. Z for the present moment. And we're going to have them have this discussion with y'all about how serious this corona situation is, because I got some friends who are acting like it's a joke, and it's not a joke at all. So let's make this work. And I don't want to be looking at... All right, so there we go. All right. So let's see if this works. Hello.
Hi.
All right, I can hear you. How you doing?
Good. How are you doing?
I'm doing all right. So you're on the broadcast already. Would you like to introduce yourself, Dr. M, or what name are we using for today?
That sounds good.
That's good. All right. So can you let people know what you do for a living without being specific as to the place or anything like that, but just like what your credentials are? And I know I'm not bringing you here to give professional advice. You are not responsible or like being charged with disseminating kind of professional information, but I just wanted to give people some background on what's going on out here in terms of the coronavirus and the reality of where we are in terms of the situation.
Yeah. So I am a family med physician, a primary care doctor, and I work both in the outpatient setting and in the hospital. And for the past 9 days I've been working in the hospital. So my last day was yesterday until my next hospital stint. So is that enough background, or do you think you need more?
No, that's good.
Okay.
That's good. And so for people out there who aren't taking this seriously, can you let them know what you're seeing in terms of people coming in to either the hospital or into clinics, and the reality of how important social distancing can be?
Yeah. I think that it's really deceiving because now that I'm not in the hospital, I'm looking around and it feels like everything is like not normal, but I don't really feel the pressure of the numbers. I'm just reading all the New York Times articles, like these articles that kind of report on the numbers. But when you're in the hospital, I guess it's really clear that people are the number of cases are going up. Like even in that 9 day stint that I was in the hospital, like from day one to day nine, like I think day one I had maybe 3 patients out of like the 20 people I take care of throughout that day. And then by the end, I think I had more like 9 to 10 people on my service. So more like half the service was someone with COVID-19. So it really is like we're feeling the increase. And the other ways that we're feeling the increase in the hospital is that it's pretty chaotic in the hospital, where like every day there's like new policy put in place to try and deal with the increasing numbers. So a lot of the normal medical things that are happening are kind of going to the back burner. And so only essential, kind of more serious things are being taken care of in the hospital. And then those areas, just like pure geography is kind of tough, like where to put all these patients, how to keep people safe in the hospital, how to cluster the patients properly, how to cluster like the suspicious cases but not yet diagnosed cases. So it's taking a lot of strategizing in that respect, and that is pretty unsettling in the hospital, because even like for patients, if you've been a patient, you might see how things are not working like normal now. And then I would say, like, So there's that kind of like strategic thing in the whole hospital. Then on our service, we're just getting like quick turnaround because people are either, you know, even to enter into the hospital, you have to be a certain level of sickness. And when you're on our service, you're not sick enough, we're going to let you go home because you're feeling better. But also contributing to the turnaround is people are getting really, really sick, and so they are going to the ICU and getting ventilated. So that is also contributing to very turnaround, like more so than I've ever had. And so that's pretty different and concerning because, you know, I can handle to a certain level of care, and then the ventilators that happens in the ICU, and those folks also being totally overwhelmed because I'm not the only person working. Like everyone's kind of shifting to the ICU folks, and they're definitely seeing just more and more people every day.
So
And
for
yeah,
for people that don't understand, what not just like the symptoms, but what actually is happening, right? So, like, let's say a person is experiencing some of the more extreme symptoms and is basically expressing like pneumonia or like fluid buildup in the lungs. What is actually killing people?
I think that's a really good question. I think we're still trying to figure it out, but it seems like there's different things for different people. Um, so one thing is definitely just like a worsening of the lung condition. So things get just so it's a pneumonia and then it just gets worse and worse. And so what I see is someone who comes in kind of like already not so great, and then they're just breathing harder and harder and they need more oxygen, more oxygen. We can only go so far, and even the cap of how much oxygen we can give is not holding breath, and so then they have to be shifted for a ventilator. So that's one way people are, and you know, just because you need a ventilator to breathe doesn't mean that you can't leave the ICU, you know. But then in the ICU, I think what's also happening sometimes is like different kinds of things. I see folks are getting septic, like meaning the infection is going all throughout their body and creating disarray in like all their different kinds of organs. That's one thing that's happening.
So
And then another thing that's happening.
for
Yeah,
people that aren't medical professionals, um, so the virus doesn't necessarily then just stay in the lungs. It somehow can travel to other organs, or it can, um, in a way, like poison the body in other systems.
yeah. I think what generally what our understanding is that, well, what my understanding is that it's kind of triggering an immune response, and that immune response is overwhelming the body. That's kind of what sepsis is too. It's sort of like your immune system is also trying to handle this whole body kind of reaction to an infection in your body. And yeah, this I think the virus is going throughout all the cells in the body, but also your body is then taking over. Its immune system is surging certain things in the body that are causing things like low blood pressure. So it's difficult sometimes to keep the pressures up. The whole lungs are kind of, it's not just a pneumonia that's hurting lungs, it's now this immune response that's hurting your lungs. Then like people are also getting heart conditions from this, like rhythm problems in their heart, also like heart attacks. So there's like a heart component to this. And then other sicknesses that we're seeing are like liver, a liver response, a liver function response where like it's just really hard to control it or know exactly what's happening, but we think this is kind of the immune system as well. But it's just causing these enzymes in the body that are really showing that the liver is working hard. And the problem is we just don't have good intervention to kind of stop these processes right now.
Now,
Although there's some things that are kind of being worked on and thought to help.
okay. Now, I know this is I'm not asking for like medical school anatomy, and like this may not be your area of specialty or expertise, but for people that don't understand, how do the lungs get oxygen to your blood? Like basically, we inhale, we get air into our lungs, and then the bronchial or like the bronchi then are able to take the oxygen out of the air and get it into the bloodstream, which then goes to the heart. Or how does this all work?
Well, the oxygen goes into your blood, and your blood carries the oxygen to all your different organs. And so, like, one thing that kind of happens in the lungs when you have this severe respiratory distress is like, and this like immune response, a systemic response to it is like, it's just harder to do that exchange into organs.
So the oxygen doesn't get from lungs into the bloodstream to the organs.
I mean, I don't know if that's like, it's very, very complicated actually, but yeah, there's like an exchange that's happening with the lining of arteries and veins in your lungs and the rest of your body. And I think those things start breaking down actually in this like acute response that we're seeing in the lungs when there's like a sepsis, when there's like a full body, when there's a very, very bad infection that is sort of more in the extreme scenario where you're like in the ICU.
Okay.
So that's pretty scary.
And so what would you say to people that are feeling overwhelmed or want to get outside or don't want to socially distance, or the reality of folks having to go to work or whatever else? Do you think that the government or media is overreacting? Do you think the government or media isn't telling people enough to get them to stay inside? What are your thoughts on all this?
Well, it's really, I really see how it's hard to know about what's happening in the hospitals exactly. You know, the other part that's really difficult is that as the numbers of, so like something, the way I think about it is like out of 100 people, 20 of those people, just based on like the other countries' experiences, out of 100 people, 20 of those people are going to need to be in the hospital. And out of those 20 people, some like handful of those people are going to have to go to the ICU, like 15, 20% or something. I'm not sure if that's totally accurate. But so as this whole number rises, the amount of people that have to go in the hospital rises, and the amount of people that need to go in the ICU rise. And so there's a lot of different problems that are happening. But one problem is like this decision to like figure out how to allocate resources, which is really, I don't think that any of us want to be in that situation, but it's sort of reality if the numbers are so overwhelming, and they already are pretty overwhelming, but it seems like it's just going to get worse. So that whole like flattening the curve thing, I really feel like that's what the social distancing really helps with. It's just like it buys us more time so that we can spread the numbers out more.
The idea would be that some of the deaths caused by COVID or the coronavirus aren't simply the result of how the virus works, but the support systems and the medical staff and the facilities being overwhelmed so that they can't manage it. If it was spread out over more time, or if there wasn't such an overwhelming number of people in the ICU at the same time, fewer people would die from the disease.
I think that's really true. And I think that if you look at the different death rates that in different countries and different like each country has their different set of resources, I think that you'll find that the people with more resources or fewer resources had more debt overall too. And yeah, I think that that's really true. And there's another component of this where, you know, even in the 9 days I was in the hospital, day one, there was full personal protective gear that we could use as healthcare providers. But by day 8, each day there was like such a change in how we use our protective wear to make it last longer. And I just think that it's going to, like, for example, in the beginning, once gear is contaminated, we're throwing it out. And then by the end, it's the idea of like, what can we reuse and like Clorox, like, so I would wear eyewear and then Clorox the outside and like try and use it again for another patient like all day long. And that's now, but I think that's only just going to get worse and worse and worse.
Now,
And I think that that's kind of difficult.
in terms of sterilization, um, you mentioned Clorox, or like we've been told to wash our hands with soap and to use like the technique surgeons use and getting between the fingers and making sure you get your base of your hands. Have you all found that like UV light can cleanse objects? Are there any things that you all as medical professionals are able to utilize to keep yourselves safe that aren't really available to us at home?
No, I mean, we're not, I don't think UV, I mean, I think like it's pretty simple, like soap, water, and then distancing. But in the hospital, when we're wearing the protective gear, it's because we can't distance. We have to kind of up close with the patient and examine them and talk to them and take care of them. So that's protective gear comes in. But I feel like if you're 6 feet away from people, you don't really need protective gear. But if you've touched like doorknobs in between, I mean, like maybe if you can have hand gel or something like that, like after you touch a bunch of stuff, like hand gel away or soap and water it, and then you're back to like zero again. Then you can just kind of like be comfortable with your hands and like, and then until you touch something else. So it's just that this weird thing about like trying to be conscious of where you're touching, I guess, and then knowing that you washed your hands after that using that special technique, like the 20-second wash rule.
And not again. I'm not asking you to prognosticate, and I'm not uh, suggesting that you have expertise in this element of it. But do you think this is going to be over in 2 weeks, 3 weeks, the way like some people are suggesting, or that we'll be up and running by Easter?
Oh my gosh, I feel like I can say definitely it's not going to be over in 3 weeks, 2 weeks. Definitely it's not. I wonder if it'll be over in 2 months or even over, but just more under control.
And in terms of control, so let's say folks are looking at this from working the problem in a number of angles. One would be preventative vaccine. Another would be developing treatment or drugs that can manage the sickness once people have it. I'm not a healthcare professional, so I don't know anything about anything. Is it true that basically there isn't much you can do once you have a viral infection, but wait for it to get out of the body?
I think the things that you can do are take care of your health. That's like a really good thing to do, and that is in your control. And I would definitely focus on things like that, like good sleep, good fruits and vegetables, good vitamins, things like that. Stress, like decrease stress. I don't know, like I try and meditate to try and decrease my stress. Like whatever you can do, like whatever decreases your stress, those kind of things really go far. But once you have the virus, I think like that's what you're kind of I don't think we can predict who's going to have like a really serious response or who's not. In fact, we've seen some really young people, like early 30s, um, in the hospital intubated with like no other medical problems. It's just really surprising. And I think the best thing to do is just like try and do the social distancing and try and keep yourself healthy, and focus on like the good things that are happening.
Does it look like there will be like medicinal treatment though that can manage it once people?
Yeah.
Okay.
Yeah. I mean, there's already a lot of things there's a lot of things that other countries have tried that we know don't work, which is important so that we don't have to try them. And then there are things that seem like they have some help. And so we are actually using them now in the hospital. But because everything is so new, it's not really based on like all this good evidence. It's more like we're kind of collecting the data now,
Right.
and seeing if these things are going to work. I mean, people have heard about the malaria drug, right? The anti-malaria drug, And I feel like one thing I want to warn people about is I've heard a lot of people kind of like try and get this preventatively, but that study that showed that it worked is very small. It's like based on like 30 people or something like that, like very, very small. So I wouldn't do that for two reasons. One, because that medicine has side effects, but two, because, in some ways, like we also want to make sure that we have enough for the really sick people who enter the hospital. So, and there's not much of it, just like everything else, that's also a resource that we're really keeping a close eye on as well.
So for people that don't know it, and I'm one of those people, what is a reasonable like study normally? Like if something were to have had I don't know, like with enough time and sufficient research, as opposed to 30 people, what would be a survey sample that is considered legitimate by the medical profession?
I think more people, the better, the more diverse, because like, these are 30 people in another country, and it's sort of like, it's not New Yorkers. New Yorkers are comprised of these kind of people. Like, I mean, people are people in some ways, but the more people you have, the more variety you kind of have in the mix. And so the more you can kind of see patterns arise. Like, someone with a heart condition may not be, we don't know these kind of things, but I'm just sort of theorizing, like maybe someone with heart conditions doesn't react well with this medicine, but someone without heart conditions will be fine. So it's just like, we just want to, like when someone is in the hospital, that's a different story. If they're really, really sick, they're the
Sorry.
risk of taking the medicine. Yeah.
So one of the issues is with a sample size of only 20 people or so, it may not take into consideration the kind of idiosyncrasies or the personal medical history of folks that weren't included in that survey sample.
Yeah. Not just even medical, but like even age, lifestyle, like whatever are the differences among humans. I think that the more people you have in the study, the more we kind of have an idea of like how there might be a variety. If there's harm in this group of people, we can kind of see it.
Okay. Wow. Um, I'm going to ask another question, and you can choose not to answer it, or let me know what you think about this. I'm confused by this concept of this all starting in one geographic area and spreading this quickly around the world. Are there any other examples of a virus or quote unquote pandemic that has moved this fast?
I think people keep talking about the 1980 flu. That was a pandemic. And where a lot of epidemiologists are looking at that to kind of use lessons from that on how to rein this in. It's not exactly the same virus, and it doesn't transmit exactly the same way. It doesn't manifest exactly the same way, but it was a pandemic of a, and it has a lot of similarities of like spread and severity
Did it
to the
move
world.
this quickly?
I don't actually know if it moved this quickly, but I know that this is this is what a lot of the epidemiologists are referring to in terms of like the last time we saw something.
And epidemiologists are
people who sort of public health and kind of patterns in
like
kind of the statistics and the numbers.
The spread of a disease.
And, yeah, or aspects of spread too.
Okay.
Yeah.
So this is the question that I was going to say you can choose not to answer. I don't know if it makes sense, this idea that this started with bats and possible bat guano, that somehow a miniature scaly anteater comes in contact with, and then a human eats that or handles that, and then all of a sudden, all over the world, people have this disease. Are there any other explanations besides animal transfer in that wet market, or are we really stuck at this must have come from some animal in a market in a part of China that people in Italy didn't come in contact with?
Well, I don't know, and I don't everything that I've listened to or like read about, I think I would be suspicious of anything that was like cut and dry about it, because I still feel like information comes over time. And right now, I think all hands are on deck in terms of like trying to control something. And that area of focus, I think some people are still focusing on it, but I think information is going to come out over time, and I'm not quite sure. So I don't feel like anyone is black and white certain about it yet.
Right.
But I'm also not an expert. That's true. But that's how I feel about it. That's my opinion. Um, and I think that I don't underestimate the spread through like kind of world travel and like also the fact that I guess the fact that this virus has like an incubation period where someone could have it, like I could have it for maybe like up to 8 days without showing any kind of symptoms. Or, maybe the symptoms I'm showing are like so mild that like a little scratch in my throat that like doesn't seem like anything. And so then I might hang out with my friends and not during the social distancing, but if we didn't have it, I would hang out with my friends and like we'd have dinner together and share stuff. And then I could give it to like that many people without even knowing that I'm sick. So I think that's part of the power of like why this is transmitted. Also the fact that it lasts pretty long on surfaces. So that's why I like when you're touching a doorknob just to keep track of what you touched and then you can clean after. Because as long as you don't put that on your mucous membranes, then I think you're good, like your nose, your mouth, your eyes.
So, what do you say to some of my friends who have said, let's just get herd immunity and basically get, like when kids get chickenpox, put them all around each other, let everyone get it, and then move past it?
Yeah, that's like very smart idea, but I don't think that, number one, I think the jury is still out on whether that's even possible.
So
we're not sure about that yet.
There's inconclusive evidence as to whether or not once you have it, you can't get it again.
Exactly. And then number two, I just can't predict who's going to tank. That's the scariest thing. We know, like, time and time again, like from all these different countries, about 20% end up in hospitals. And then some other percentage, like 15, 20%, die. That's a lot of people.
Right. Especially in a place like New York with 8 million people.
Yeah. And I think, like, as the resources get harder, it's going to, those numbers can change too because we don't have enough ventilators. So someone is going to die a little bit earlier because they couldn't get a ventilator. Or someone had to come off of the ventilator quicker because,
right,
we needed that ventilator for someone else. So I'd rather just not be in that position if we're still in a place where we can prevent that from happening. Like, I think that would be best,
right,
if possible.
Okay.
And that's why all these severe measures are in place.
Wow. Is there anything you would want to tell people or let people know? Because I know you have to go in another 5 minutes or so. Is there any information you'd like to share with everybody?
I don't know. I mean, I guess I would just try and focus on like doing the things that we can do. And there's a lot that we can do. The social distancing is one, but also like kind of taking care of each other and like not letting the anxiety get the best of us. Like, I know I have to kind of check in with myself about that regularly. And just like, I think the focus should be on like trying to help each other get through this and trying to think of us as like all together in the same boat, trying to figure this out.
As a medical professional, what can you suggest we can do to stay healthy mentally and physically while we are socially distancing?
I mean, I think it's like I think similar to like when you're not socially distancing, except that now you have to be a lot more creative out. Like, so, the sleep we mentioned, eating well, we mentioned, hydrating, that's important. But the social piece, like we all are human beings, so we need that connection. And I think that's really important too. But we just have to be a little bit more creative with the social distancing part. I think exercise is important too. If you could do it kind of more solo outside or inside your apartment. I think meditating is really awesome in general to decrease stress, which we know boosts your immune system. Um, I think what we know kind of doesn't help your immune system is a lot of stress and a lot of, just a lot of stress. So whatever you can do to like kind of like the things that you enjoy doing, I would do those things if you can. But there are some really tough problems that are happening during this time period, and it's tough. But hopefully, kind of try to do it with other people, like trying to get some help where you need it. I think that would be really important.
Are you noticing like issues in terms of folks that are having issues with addiction when we're saying like try to manage the stress? Like for me, I've had to stop drinking and I've been like trying not to smoke, and I'm now trapped in the house. I'm stressed out and it makes me want to do drugs. Like I never did drugs. Like I only smoked weed and drank alcohol, but it makes like all this stress and all this stuff. I'm seeing everyone else go to the liquor store and people are sitting at home like, well, I'm just getting drunk while I sit this out. And it makes me want to drink, but I'm trying not to drink right now. And alcohol does have an effect on your immune system. Smoking has an effect on your immune system. So what can we say to the folks out there trying to manage their addictions during this time period?
I think it's really, really hard, and I don't think there's an easy answer. I think that I don't know. I mean, this answer doesn't work for everyone, but like trying to reach out to the resources that are more positive for you. Like if you are going through something and all this is getting the best of you, like could therapy help, or like maybe therapy, not formal therapy, but like other forms of therapy for you. Things that there's a lot of things, I guess, that are good for us that we enjoy, and then there's a lot of things that are like not so great for us that we enjoy as well. So if you could just like kind of shift over, but that's so much easier said than done, I think. I think it's really complicated. But there are a lot of like professional organizations out there, and I think there's a lot of creative things right now happening to try and help people. And I think some of them are coming from organizations, but some are coming from just like neighbors and people. So, I
Are
don't know, like
are there any organizations you know of that are like kind of call in addiction support hotlines, or any organizations people could reach out to?
for, well, there's all different kinds of places, but like for more, for alcohol, like I think Alcoholics Anonymous works for some people. It doesn't really work for other people. I think other places with like therapy, the Jewish Board is a place that has great therapy. Um, there are a lot of different places out there, like even just looking at if you have insurance, like looking at your insurance card and seeing if there's a therapist, because, people are now doing like more therapy, telecounseling. Even like I can see how everything's happening very dynamically because this has only been with us for a little bit of time. But I think people are trying to, like, if there's group stuff that makes you feel better, they're doing that through a lot of online stuff. So I think the isolation can really eat us up and make things worse and harder. But there's actually a lot of like things that are happening to try and connect people.
Okay.
I wish I had those resources at the tip of my fingers, but I know, like, I was listening to NPR the other day. They had like a whole list of things that like people were doing. Like, I don't know, there's all different kinds of things, like group sing-alongs, group yoga, but through all online stuff. The sing-alongs were happening like physically outside. People were like doing that outside the window in Italy. I think, like, I don't know. There's just a lot of different kinds of things that can happen.
Okay. Well, I mean, I really appreciate this. I hope that you found this to be not too stressful, because I know like you're not necessarily a correspondent or used to getting hit up about interviews in terms of medical information. But I really appreciate it, and I hope the people that see this are able to appreciate it and take everything seriously, and get some information out of this.
Yeah, thank you so much for giving me a chance to just talk about some of this, because I think like there's a real disconnect between what's happening in different sectors of our society. I think trying to understand what's happening, I guess it's like reading and like listening to radios and like just trying to figure out what's happening in all these different areas is helpful.
Well, I appreciate it. I appreciate it. All right. So I'm gonna have one of the other homies call in a second, and
Okay. Thank you.
yeah, thank you very much again, Dr. M, Dr. X, whatever you want to call yourself today. I appreciate it, and you be safe out there. Shout out to all of the healthcare workers and all the people that are risking their safety helping other people. Let your folks know that we thank them. All the people like me who just make art and who get to sit in the house live streaming and talking about this stuff. Y'all are out there on the front lines. Thank you very much.
Well, thanks to everyone for social distancing, and yeah, be safe. Everyone be safe and take care of each other. All right. Thanks.
All right, peace.
Bye.
All right, so there we had Dr. M, who was giving us some information about social distancing, the reality of what's happening in hospitals and clinics around the country, and what we can do to keep ourselves in good spirits, to stay positive and healthy during this time period. We have another person calling in. I have my homie Ohene Cornelius. What's up, brother?
Yeah, what up, man? You can hear me?
Yeah, do you have me on speakerphone?
No, I don't have you on speakerphone.
Okay, you're a bit fuzzy, but what's good?
I'm chilling here, like having a good, having a great quarantine right now.
Good. I'm glad to hear that.
Yeah. Hold on, let me go in the next room for a second.
All right, bet. Now I'm bringing in Ohene. He's one of the homies that I've been working with the past number of years. Musician, comedian, actor, parent, all around innovator and creative. He and I have been discussing the realities of the government controlling our movements, what this is doing socially for people, as well as what it means to be socially distant and still have a meaningful life. Something that came up yesterday while we were speaking and we got cut off was this idea of like how many of us are willing to give up our rights and freedoms for the safety and protection against this virus. And we didn't really get to go into it, as well as how is this going to affect wealth redistribution. At the end of all this, these very wealthy people are probably going to own more land, more stocks, and make more money, while people like me have no way of making money, and I'm not allowed to go outside right now and make money. And how that all plays out. So, are you there?
Yeah, I'm still here, man.
All right. So what were your thoughts on this? You were saying yesterday, like, what are we giving up for this protection?
Yeah, it's a very thin line that I like to walk with, the idea of like humanity and what we're doing in terms of control and in terms of how much control the government has over us. They have guns we're not allowed to have. They're already allowed to. We have to apply for business business applications. I can't just run a business. A girl who's been doing hair her whole life. She's a child. She learned how to braid hair as a kid. She's been doing hair her whole life. And the time her hair braiding business starts to take off, she has to LLC it and start to pay the government for what she naturally does already. So we're in a place of they're trying their best to put a marker on our money. Basically, they're trying to make sure that every dollar that's made, there's a way for them to get a piece. And I'm concerned with the idea of freedom and the free land and having that, like martial law might get over. You definitely won't be able to go out. But I'm like, you want that? That's what you're willing to give that up. Like I will willfully stay inside for the betterment of the humanity up until a certain point, for sure, because it's important for me to make money. And I do know that people who are wealthy, who have health insurance, who have quote unquote essential businesses, even if they're weed man now, the young weed hustler that I knew was arrested, and then they replaced him with the iPhone store of weed, and now that's an essential business. How cold and cruel that is, that still doesn't make myself not have to buy food. And it's only but so much charity that my friends are going to reach out to me with. It's only so much streaming money that I can make in a short amount of time. I can't really make money from shows right now. So there's a other way in which I have to learn the industry. And if you know, for thus far in the music business, most of the money, the big money for artists especially, is from touring. And that was just crushed. That whole industry right now is crushed. And it's not forever, because, you mean to tell me I'm going to have to give up fucking acid in a field while listening to music and giving hugs to random people forever because of the COVID-19 virus? That's scary to me. And Dukes brought that up to me, and I think I didn't really realize the immensity of like giving a hug, that we talk about how human contact is so important, and it nurtures us. I can't hug my brothers now. I can't hug my sisters. Everyone, it's okay to be socially distant, socially awkward, and it's okay to not care about other people. And now I'm not saying that. I guess it's a conversation about boundaries. It's a conversation. It's a new generational thing that's going to have to be a conversation. Society's moving so fast, and I don't believe everything the government tells me. I'm sorry. I know people might call me a conspiracy theorist, but there are evil people in all aspects of life and all walks. There are doctors out there who don't care. They're just trying to take cases that they can win so that their numbers stay high. There are lawyers who do the same. There are government officials who take advantage of terrible things that happen within society for their benefit. So I just don't believe everything the government tells me. So I'm at a place where I got to make money. There's only so many loans, and so I guess I got to better my business. But also, my business wasn't doing bad in the way in which it was going right now. It was like I was able to survive. I had money in my pocket, and then added with other businesses added to that. That's how millionaires are made. And I just feel like, there was a very I don't want to say plan. I don't want to say, because I don't want to make it seem like it's all a conspiracy. But there were some benefits that people who already were winning systematically got off of this. That really bugs me. And it really makes me mad, and it really makes me look at other people who are in my level like, how dare you tell me that you think that we should go under martial law? So that, it's dangerous. And 1% of the population might die. But you will give that, in exchange for that 1% of the population dying, you will willfully be a slave. At 99, you would rather 99% of the population remain slaves here, rather than have 1 or 2% die. That, to me, is an egregious give up of a human right. And when, by the time, the amount of generations we will be to get those rights back, we would be looking at an all-out physical fucking massacre of war if the earth doesn't destroy us first. You feel me?
Now, help me understand a bit more about this. Are you saying that some of the changes being put in place will not just be temporary and will require some type of extreme action in order to...
Literally cash money. People are going to be afraid to exchange cash money. They're making it more digital. They're talking about the singular global dollar, which they've been trying to do for years and years now. And people are like, no, we need to have our separate currency. But now that this virus has been something, now that everyone's like, hold on, maybe we do need a global currency. And that puts money and power into the hands of people who already have it. And they have now control, and they can suppress numbers as they want, can push numbers. They were already stat pushing. All these cops over here in these neighborhoods, we want you to give these people more tickets than you would over here. Be lenient over here. So those stats are pushed already. We already have these problems, and it's being controlled by minor interests for major understanding or major major happenstance. So the idea is that these people, I think people are willing to give up too much in this time, in a small amount of period of time, which will allow them to accept things in a longer run. I'm not saying that the government will put it for longer, but they could once you give them that power. So it's like, yeah, if I'm going to lay down my gun as a citizen, that means the government has to lay down their gun too. And we both have to risk being damaged or hurt by another government to strengthen our connection as a community. If you're not going to lay down your fucking AR-15, I shouldn't have to lay down my shotgun. And it's like, it's weird from New York, and I'm not even a licensed gun owner, but this made me think like, hey, maybe I should be, because no one's looking out for my better interest. No one out here. I'm out here trying to be the better person. I'm trying to run business in an organized and serious and very good way. But there's so many people out there that's running game and trying to be evil. And I've had people complain about my comedy shows when they're like, yo, you're not paying the comedians. I'm like, yeah, I niggas been doing bringer shows. I'm out here. I don't have the money to pay that. When I do a show, it all goes right back to if I haven't paid the comedian, that means I didn't make anything. That's all it means. You know what I mean? But we're so used to like being used and buying into the system of what's right and what's wrong. What's the difference between a young lady who's braiding her hair in the house and a young lady who LLCs it? And now the government acknowledges. It's like, get your hands out my pocket. Why are you always in my pocket? Like, why are we not? Why am I not born into a sovereign state or a sovereign country as a sovereign country and then allowed to join the U.S. Union? You feel me? I should be an individual first before I'm like a business or a product of the United States. These are just my thoughts. Partial ramblings because I'm putting it all together as I'm seeing it. And I remember we were having a conversation offline, and you were like, "Yeah, this is you just now recognizing that." And I'm like, "Yeah, for me as a human being, because that's what I'm trying to tell people. That's the problem. Like, we're not teaching our young about this. Why is the military, right? We're talking about the military might have to come through to enforce a lockdown. I'm like, why isn't the military equipped with being doctors as well? Why the only thing they know how to do is strap guns to their chest and then oppress people?
Well,
if we need more doctors, why they're not the doctors that we need?
Well, so just to chime in, you already know I am not a fan of anybody having guns, especially oppressive regimes, which that includes the state, the nation state, and the military apparatus that is the enforcer of the nation state. But I also have to say I'm getting some of my information from a military surgeon, a friend, a very close friend who shall remain nameless. Her sister is one of the head doctors for a base over in Afghanistan. So they called us, or they texted us, because you can't call, whatever, they're too busy. But they sent us a text like 4 or 5 days ago being like, yo, if not longer, actually. It was before the kind of New York lockdown happened. So maybe like a week ago, and was like, yo, y'all need to take this shit seriously. We over here, we're seeing what's happening. And she got into a huge fight with the higher-ups who weren't necessarily taking it seriously and had to explain, like, y'all don't know what this is about to do. This is not like the other flu. This is not like anything we've seen before. We don't have the facilities to manage it. And so she's helping to develop the protocols as a doctor for military bases and for people in situations where they can't do social distancing. And she's seeing the ramifications of what's happening in a real way. And so I do want to say there are folks in the military or in branches of science and study who are applying their skills to this problem. We just don't see it. You know what I'm saying? Like my homie that I brought on earlier was saying, if we're just like a layperson like me, I'm not seeing the effects. I'm not around anyone ostensibly that is super, super sick. Now, I have a couple of friends that think they've contracted COVID and they were sick for 5 days. They look horrible. Melissa works at a school, and so in the school community, there was a principal, not at her school, but at another school in Brooklyn, who was only 30-something, who passed away. There have been teachers and students diagnosed and that have been hospitalized. So it's real, but it's not like I'm seeing it right in front of me, like when there was gun violence in my neighborhood or where I was growing up in D.C. or I'm not seeing it like when I was in Bushwick and people were getting robbed out in front of my building every day, or whatever else is going on. But there are folks who are concerned with this issue. I do share your concerns and your kind of skepticism about, does the government ever really help us? And I don't mean the U.S. citizens. I mean people like you and me, where like I make art, and a friend of mine's an attorney who was like, yo, you should have a business. You should get a check. I'm like, I don't own a business, man. The art that I make is not lucrative enough for me to start a business. When I went to a bank and I asked for a $3,000 loan so I could start my business, they laughed like, yeah, small business doesn't mean that small. And when I looked it up, that small businesses can range up to taking in over $15 million and have over or up to 500 different employees. So when you hear the government saying they're supporting small businesses, they don't mean your homegirl that started a hair braiding company out of the house and has 6 clients a week. They're talking about an auto body shop where they employ 30, 40 people and make hundreds of thousands, if not millions of dollars a year. There are going to be tons of people like me that get no bailout because I'm not on paper as a business. And the art that I make wasn't lucrative enough for me to want to start a business with it. And what happens with us? We're not going to get some of these benefits. And so I am concerned, like with the Patriot Act, after September 11th happened, people got all freaked out and we gave away our rights, or things got passed without us knowing it. I don't know what's in some of these stimulus bills. I don't know what benefits are going to come to some of these big corporations that already are billion-dollar companies and have employees that are making millions of dollars. They're going to get a bailout, while people like me, literally, if I don't get a check for 2 weeks to a month at a time, I can't eat the way I was eating before. If I don't get paid for 2 months, I might lose my apartment. You know what I'm saying? And so it's like a different world.
Yeah, it's definitely putting a testers to my mind. And that's mostly why I've been in the house. Like, I've been trying to learn new skills. Like, what is it that I can do that will transcend my skills thus far? So I'm lucky that once like acting starts back again, I'll be able to do that. Small concerts with music, how I maintain money in between acting jobs, or like doing comedy shows right now is turned up into another level, because it's like, and comedy has been my main source of like thing in the last year and a half. That's been my main source of finance, and it's actually been taking off for me. So I'm running into like a place of like, shit, I was actually building steam up. Important steam is. So I was on the internet and people got mad at me, and I'm like, yo, do you know how steam is right now? And I think about Kobe Bryant, who passed away before this, and think about other artists and athletes who talk about the ability to continually show up even when things are not, when no one else is showing up, so that when things are happening, that you're ready. And that's what I don't want during this time period, that hunger to leave. I don't want that skill set to leave. And I also want to be able to, I think the ability to safely put people into a building now together will be highly payable. Like the risk to rate, I think ticket prices is going to go up for live shows. I think like in terms of like album sales, there's probably going to be a new streaming service that I feel like is going to come out from this. I feel like there's going to be some new jobs that's going to pop up, because with the closing of jobs, the opening of other jobs will happen. So either delivery service is going to be a more of a booming business. So it's more like now, like how many, like all of those people who are waiters and stuff like that, now they're going to be delivery people. And that's going to be a whole situation where you deliver, but there's going to have to be an experience behind that delivery, because people are going to want to set themselves apart from regular just delivery people. Like and everything becomes a vie for pay me more. And we slip right back into a place of capitalism. And I thought while this time was happening, I would give some push to the regime of people that have been trying to control us, because those people are really us. And there's a lifespan on that, and those people are our citizens. Some of them are born into this, but they can be swayed. Like any system, there can be and have to be and will be change. And if there is a virus, there is an antivirus. If there's a capitalism, there is an anti-capitalism. So while this is happening, it has showed me like the people who are around me who are like, yo, I'm a socialist. Here's some money. Yo, I know you do music. I know we got to reach out to do art. I had this regular job for all of this time, and I know how it is as an artist. You have to have constant influx of project so here's some money. So I respect those people, but after a while, what happens when they and that's where the art comes from. You're gonna have to sell your art to those fucking devious landowners who are buying up all the land in New York. You're gonna have to sell your art to fucking to make an impact. If you don't want to be in this position anymore, if you're cool with the next time all of this shit happens, and I'm particularly not cool with the next time this happens, I'm not having my own big enough space so that my son feels comfortable enough to like go back and forth or to stay with me instead of like, that's a real problem that occurred because of not my commitment to being a capitalist. All this time in my life, I've always been like, yo, do what feels good to your heart rather than do what feels good to your pocket. And I'm coming into this place now. It's like I'm coming to a moral standpoint. Like, yo, I gotta fucking start putting money before people. Got to start putting money before myself, before my own choices. This doesn't feel right. This opportunity doesn't feel right, but it pays right. Fuck it. Because when COVID-21 hits or COVID-29 hits, nobody's gonna give a fuck, and nobody's gonna want to save me, and nobody's gonna want to donate and download. People are gonna want to send me like fucking Bible verses and like thoughts and prayers, and it's on me to be prepared for the next time. Yeah. It's on me to have enough money saved, and that means that I'm gonna have to sell my art in a way and to people that I feel like it wasn't for.
Well, yeah, I mean, next time I bring you on, I think I want to have a conversation with artists as to what this is going to lead to, in the sense of if there are new streaming sites that come up, because we're noticing there's so many things we can't do. We'd love to be able to do group kind of jams, and you can't. Like, you try to go into Google Hangout, only one person can talk at a time. You want to use Zoom, there's no audience outside of the people inside of the room. You want to use Twitch, you can only bring on certain folks at a time. You want to use Facebook Live, they mute the sound afterwards if they think that you've used songs that aren't yours. There are all types of problems that we're running into with independent broadcasting as people have been trying it, as well as the inundation and saturation of how many artists are now on the internet saying, give me money, while people are sitting at home like, dog, I may not have a job. I'm not spending any money right now. And so we're running into a supply-demand issue. And who's going to last? Who's going to look up? And artists that have been touring the past 2 or 3 years that can't tour for the next 3 or 4 months, where they got to go get a regular day job. And once they get that job, they're not coming back off of it to tour again. What's going to happen is some of the momentum or some of the steam from certain artists that were able to occupy a niche, and now it's gone. Like, they're not doing their shows. They're not doing their performances. They're not out there interacting with the people.
Like, I've been racking my brain on how to better smoke some jokes already so that people feel safe, so that, like, people be smoking, coughing already happening and shit, so you're going to be nervous about coughing and shit. Like, I'm thinking about, as a comedian, from a comedian standpoint, my mind, I'm tearing apart my own show so that I can it up, so that people going to want to fucking fuck with it, because it was something that was building up and it became worthwhile. And also, I think about also all the people that didn't give a fuck about this shit while COVID was happening, and they could either be sick or not, but also those people, like some of those people, I need some of those people on my team, you know what I mean? I need some people who are willing to be wolves and willing to, like, all right, COVID is out there, but we still got to get better. Some people are going to naturally die in the order of things, and it's fucked up, and we're going to try to protect ourselves, but to stop what we're doing only allows richer people to win. Amazon wasn't like, yo, we're going to deliver all essential goods for free. Amazon was like, yo, we still want that money. Fucking Time Warner, they're going to suspend the bills, but when that shit come back, the money. Metro PCS, they get a break on my right now. They're like, yo, you have it in the next 30 days. But then it becomes accounting for me. I'm like, yo, I gotta find. Once those 30 days is up, I'm coming back behind. I'm coming back more behind than I was already. Like I was already check to check, and there's people who are mid-level check to check where they're check to check, but they got some savings. Their bills ain't that high, so they live in a way they check to check, or they're check to check. Like, all right, they live from month to month, but let it get down to 3 months, 4 months, and you know what I mean. And people are like worrying about toilet tissue. I'm like, what? Like there's like I've been to actual fucking third world countries. And people are like, oh, it's not a third world country. I'm like, yo, there's no sewer system. People are like defecating on the street. Little kids just defecate right there. Like there's like you really got to wear those masks because the disease is rampant and floating around. And I never understood it when I was out in Southeast Asia. That mask stuff that's been a part of my mental Rolodex for the past 4 years now. And it's just coming here now, like to have a designer mask. I'm seeing here popping up people wearing different types of masks. And I'm like, yo, I never got it in Asia. Why the fucking people doing that? And I was just following along because I thought it was cool and shit. And I thought it was because of the smog from the you ride on your motorbike and you have the smog from the bikes. But also they was protecting themselves from shit that they knew, like because don't have the same luxuries. It wasn't like Purell everywhere. Like you come here everywhere, Purell everywhere. Yeah, just fucking I'm Purell my whole body. And you just fucking squirting on and you just Lysol everything. But what do you do when you're in the middle of in the fucking hot ass tropical jungle and then the shit drops, the weather drops and then now all of those diseases and like festering up and laying there has now become undormant. It's just laying in the air. You're just walking by that shit. So it's like I'm getting bank statements now that are starting to look ridiculous. Like I was like, this is all of my automatic fees that come out, my Spotify, that just lets me like keep from going nutty, keep from being. It's funny because all the things that my black parents was talking about, that's all they saying now. Why you always running the streets? Stay your ass in the house. Wash your hands. You know what I mean? Like, oh, you can't sit on the bed with your street clothes. All of that shit. Like people are like, yo, you gotta do all of that. Don't be all up in people's faces. You gotta do all it like that. But our parents been telling us this shit for years, yo, and it's bad funny to me.
Yeah, old ass black people was never wrong about that shit. When they like nothing good happens after midnight. Where you going? Why you going there? Your friends dictate who you really are. All that shit, man. But they also came from a time period where there was no setup with ventilators and hospitals, and if shit went wrong, it was on you and the people that was in your community, and we didn't have the resources. So it was definitely like you had to be clean, you had to practice good hygiene, you had to behave a certain way socially. You couldn't be flopping all out in the grocery store, pulling everything off the rack and throwing tantrums and shit. There was like
there's only one doctor in town. You know what I mean? And that doctor's busy either like serving, like delivering a baby or like, you know what I mean? You got to stay healthy. But that's also a part of like with me, like with education, like there's like a lack of education for like basic taking care of each other, like CPR and shit like that, how to wrap up a bandage and not get each other hurt, like how to keep yourself socially distanced but still act. All of these are going to have to be stuff that we teach young children so that we're equipped individually with this information as well, because we're so separate now. And yeah, the government we shouldn't rely on the government for everything. They're not my fucking daddy. Like I hire them to make some decisions, but they're not my fucking, they're not gods to me. They're part of like people are like, oh, Cuomo, he's so sexy, he's presidential. I'm like, y'all hired him. We hired him. I mean, that's what he's supposed to do. Like the part of his job is like get some shit right. This shit that Cuomo hasn't and won't get right, but like his job is to get shit right. That's like when I used to be like, yo, yeah, I take care of my kid. People like, so what, nigga? You a father? That's what I'm like. Oh shit, yeah, you're right. That's my job. Like, you know what I mean? Now it's like, all right, yo, I get him into extracurricular things that he normally wouldn't be in, so that he can expand his mental clarity. Then it's like, all right, you going beyond like regular taking your kid to class, fathering, offering up some funds or some, like, you know what I mean. Then it becomes stuff that you can at least tell about, but it's not like you doing your job. There's a crisis. You should also be able to like have a meeting with different people and tell us what the fuck is going down with the crisis.
All right. Well, I appreciate it, man. I'm gonna try to bring on our last guest. I've been rocking out.
Yes. Before I go, I know you be having like 3 to 100 followers on here watching, so I don't know who's gonna watch, when they watch it, or if they watch it right now. But I just gotta say, I dropped one of the dopest projects this year called Lenox Avenue. I used only my first name, Ohene, Ohene. You can go on internet right now, wherever your internet is hooked up to, go on and download, stream my album. It's on Bandcamp. I got a different version on Bandcamp than the one that's online. The one online is the version that I released with the newer songs, and it also had some songs taken off. The one on the Bandcamp was the one that I was selling that allowed me to put it on digital. I thank you for that idea to sell it first analog, go straight directly peer to peer, have people buy it from me first, so I made my money first. So I want to say that everybody who streams it from now on, yo, go ahead, get those little bit of, send me those little bit of 0.0 cents for the future, because that stuff, residual incomes matter, because I may not be a millionaire now, but with your help, with your guidance, with our connectability, I'm offering up stories of my life and of the world in exchange for your money, even if it's a little bit of it. So please go and stream that. I'm going to come out with another project either later this next year. I've been practicing my guitar while we've been on this quarantine, so listen to anything I have on the internet. Ohene Cornelius. Listen to anything I have on the internet. Go to my YouTube page. Subscribe to my YouTube page. Like, I'm trying. I want to make more that reflects these kind of times. And my brother's like, yo, you got to make the funny, haha shit. And I'm like, I don't know if that's me as an artist. When I channel my art, I like maybe like through comedy, but when I channel my art through music, I'm always trying to make a statement and a certain part of life. I find words for this moment in time, but definitely thanks for having me and talking with me and stuff like that. Whatever this is you're creating, go further. When I looked back at it on the internet, you were scrolling through the page and able to like talk to me and look through the page, and people could see what I was saying. They could see my page. I thought that was so innovative. And you have to go further, figure out different ways to link in everything in there, and figure out ways for us to get paid on these channels. So if it's like any music you play on there, you're gonna have to get NDAs or music licensing forms or something like that to get it cleared, or file for some kind of minor little radio station. But it is what it is. It is what it's gonna have to be. If the government wants to try to fuck us, we're gonna try to do our best to fuck them back. You know what I mean?
I mean, you already know you don't get to play with the devil's butthole and not also get fucked. So I mean, I don't look at us being able to get over on the government, but I do understand there is a certain amount of paperwork that can just allow us to do what we need to do. And at this point, I'm learning. I'm taking this time period right now to learn new skills. I'm trying to educate myself in some arenas where I've had very little experience and come out of this ready to run, ready to go hard. I can't let this cripple the spirit. You know what I'm saying? Like last year was hard. This is going to be the summer and the spring of like, oh, we back. And now this is happening, but I'm not going to let it get me down. And if anything, it's just more motivation that when we come out of this, it's about to be out the hyperbaric chamber. Like, I don't watch anime, but what people tell me is like when Goku came out the bubble, we about to be level up, Super Saiyan style. So
yeah, you got enough time, yo. Watch some of that, yo. Super Saiyan used to be my shit. Like, watch Dragon Ball Z. You got enough time. Goku, Vegeta, fucking Piccolo, Gohan, all of those. Like, no, when you really like it, really. Now that you say something, when you really focus in on your gift, like I think like with comedy now, like my manager hit me up the other day, right, while this hiatus was happening, sent me in for a voiceover joint. that wasn't a lot of money. It wasn't paying a lot, and I was just like, look, man. This is before the tour, and I wasn't cocky, but I was feeling myself like, yo, I'm doing comedy. This is what I want to do. That's why I spent so many years not focusing in on this. And he sent me a message. I was just like, look, man, I appreciate you sending me out. But if the work that you're sending me is not this type of work right here, if it's dramatic work, it has to stretch me as a dramatic actor, or it has to be comedic work right now. That's all I'm looking for. We don't need to talk other than that unless you just want to have a polite conversation with me. And I thought he was going to be like, nah, you're fired, fuck you. And then today I get an audition for a comedic role, an animated comedic upbeat person for a movie. And I'm just like, now we're talking. Now if I lose, at least I'm losing in the game I want to play. I'm not playing another person's game mad and shit and losing. You know what I mean?
I definitely feel that. I definitely feel that.
Yeah, but do virtual drinks. I've seen DJ D Nice is doing like virtual DJ and stuff. You can invite one or two people over now, get your Lysol up, spray niggas when they come in.
Yeah, I don't know, bro. I'm keeping it safe for a second. And Melissa's on me like the hawk on some more like.
Yeah.
Yo, I'm not allowed to do anything.
Yeah, I get it. You know what I mean? But some people are like, I see some people they still congregate on the corner with masks on, with beers and masks on, which is mad funny.
Yeah, I mean, I be seeing these people. You gotta keep in mind, man. I'm up here in Greenpoint. These motherfuckers out at the dog park kicking it. Like they acting like, oh well, we're the same 6 people that kick it. We trust each other. They don't get that. It's not. That's not how it works. It's not like. You can have a sign on your head that says whether or not you are already infected, whether you're showing, but that's for another conversation. But people out here are just still doing what they normally do. I'm trying to stay in the cut, and this might last a long time, so I'm just trying to, while I can be in the house, handle it, and then if I have to go out, I'll be cautious. But I want to thank you for calling in. I'm gonna get my last guest up here. Shout out to Ohene Cornelius, and we will speak soon, bro.
Send me money. Cash App, memo.
All right, peace. All right, I need to check and make sure that this has all been saved. So I'll be back with my last guest. Give me a second. Of course, I got my Facebook account frozen, so I'm going to have to record. I'm going to have to record first and then post it to my other account. But all right, so we are here with, do you want to use your real name or do you want to use a kind of surrogate name and go by Nurse X?
Just the first name is fine. Hold on. Okay.
All right, so introduce yourself and what do you do professionally?
Hi, my name is Laura and I am a nurse. I work in Hawaii and California.
Okay. How have those areas been hit? California is under like full state shutdown. And what about Hawaii?
So far, Hawaii, we are in a shelter in place, order from the government. But so far, most of our cases are from travel related. So we don't actually have a big community outbreak right now.
Can you explain the difference?
So community outbreak would be like if it starts, spreading throughout homes, communities, versus travel related. All the cases so far in Hawaii, you can, we've been able to identify they were exposed by someone who traveled recently or they themselves have traveled recently.
What do you think is limiting the spread and amongst community?
Gosh, that whole social distancing.
Social distancing.
I mean, yeah. I mean, it's rough. It's rough for a lot of young people who don't think, that when you're young, you're healthy. You feel like you're invincible, you're not going to catch it kind of thing. Or if you catch it, it's going to be mild. But it's just amazing how fast this thing is spreading. So it's been just so important for people to just doing everything and stay at home and not interact with people.
For people out there that don't think this is a serious matter, how have you seen it affecting the hospitals in which you were working?
I mean, I see it in like small ways where people think that they're above this and they're going to like the beach still or like meeting up to play basketball. And I've even had, close friends of mine be like, well, it's no big deal. All of us are young and healthy. We're going to meet up. But I've stopped them and asked them and been like, well, do any of those people have um, members in the medical field um, or like many people in Hawaii are like living in houses that are multi-generational, so they're like, you might be going out and playing basketball with all your friends, and you might be fine. You live at home alone or you have like young roommates or whatever, but they might be going home to like parents, grandparents, like aunties, uncles in the house. And that's then like putting the hospitals at increased risk for like these mass like spreading and increased in like hospital admissions.
What would you suggest to folks who, I guess, how do you make it more real to people without scaring them or like giving them like crazy kind of like fear mongering tactics? How would you persuade a person into taking this seriously, or why it would be important to stay away from other people and socially distance?
Like how to convince them to take it seriously? Is that what you're saying? uh, Gosh, I mean, it's just so hard. Like I've realized that in my network of friends, like a lot of, I know most people in hospital settings, like healthcare workers. And so it's so real on my end when I'm hearing stories from nurses and doctors across the country. And I've realized that like if those people are not in your circle of friends, like a lot of people are just not aware of how severe it is and are still kind of comparing it to the regular flu. But even like with all these differing like statistics and whatnot, like I mean, you can ask any nurse or doctor across the country, like, have they ever seen anything like this in their hospitals before? And they all agree they've never seen it before. They're all super overwhelmed, overworked, are working in really like kind of poor conditions. Like they're pretty scary conditions right now for all these hospital workers. So I don't know, people who are not taking it seriously, I'd kind of recommend try to ask someone you might know, like, do you know someone who has a family member who's a nurse? Ask them, how's it going in the hospital? Like, what is different right now than at other times? Like flu season's always busy in the hospitals. So flu season is usually like winter time. But is this similar to any other flu season? I see every single one of them will say, no, this is outrageous. We're just at capacity.
Now, because I'm not a healthcare worker and I'm about as far away from a hospital or a clinic most of the time as possible, what are some of the differences that you are seeing, or like what are some of the ways in which you're saying people are having to work in these poor conditions?
People on the front line, like in the emergency rooms and the medical surgical floors, the ICU, they are being required to take more patients and more sick patients. And then the whole issue without the proper like protective gear. So then just every day I'm just hearing more and more stories of healthcare workers sick because we also have the proper protective gear. I forget what your original question was and if that
Like
answered it at all.
some of the conditions. So the staff being overworked, them not having protective gear. What are other things? I guess the influx or the amount of patients they have to see.
Right. So the increase in like respiratory cases. So a lot of hospitals have been setting up tents outside the hospital. They're almost like emergency like tent hospitals, where if you are having any respiratory symptom, they want to separate you from the normal case come in the ER, like car accidents or a chest pain or like an appendicitis or something. Separating everyone into these like respiratory tents test you. And then even in Hawaii, where we've only had, I don't know if we've reached 100 cases yet. Probably today we'll reach 100 cases, but every ER nurse I've talked to on island says that people are coming in just really sick, like young people as well, like, and it's kind of happening fast. Like normal flu, people when they do have complications from the flu, it's kind of similar where they end up getting kind of like a pneumonia or other complications. But with this COVID-19, it seems like people are getting sick fast. Like they're walking around normal and then, having simple like cough, fever, and then really quickly going into like a respiratory distress where they're having difficulty breathing. And it's just something we haven't seen like this before in so many people.
I had on a physician earlier who was discussing the way that this virus affects the body. One thing they were saying is the kind of pneumonia symptoms. Another was it can affect organ failure or like cause issues for the heart or the liver. What have you heard are some of the complications that are the result of this virus?
The biggest is the pneumonia, where, like usually if having flu-like symptoms or anything like that, usually you can manage it at home. But if you do start developing this sort of pneumonia, um, it's quick and you're developing like shortness of breath, difficulty breathing. And that's what usually is bringing people to the hospital initially. And then if you are having that much difficulty breathing initially, they'll put you on oxygen support and then some sort of like pressure support to kind of like help your lungs keep inflating well, to oxygenate the rest of your body. But then at some point, if you are no longer able to like breathe well on your own and oxygenate your body, they are putting people on ventilators to like some sort of respiratory support. And at that point, it just puts you at further risk of other things going wrong in your body. When you're not oxygenating, like your organs start failing. And it's just like further complications. Every day that you're on a ventilator just puts you at such a higher like risk of mortality, basically.
So, for people that don't know, pneumonia is kind of what, a fluid buildup in the lungs, or what would be some of the symptoms? I know people are relatively familiar with the dry cough and the symptoms associated with COVID, but or the coronavirus. But what particularly stands out when someone may be exhibiting symptoms of pneumonia?
Um, I mean, when you're not able to like take a deep breath, you're not able to inflate your lungs all the way because there is fluid building up in the like lower parts of your lungs, and that then you're at increased risk of other kind of infections, other bacterial infections. That's when they would start you on antibiotics to treat if you have like a bacterial infection added on to the virus. A virus is not treated by antibiotics normally, but if your immune system is already depressed from this virus, you're at higher risk of like developing other infections, and going into like a respiratory failure, or like they call it acute respiratory stress syndrome. So like
Can
your
you say that again?
alveoli and your
What's that called?
acute, ARDS, acute respiratory distress syndrome.
Okay. Sorry, go ahead. Keep going. I just want to make
Oh.
sure we had the name of that.
Oh. I mean, it's you can look it up, but that's what's going on when you're developing like a pneumonia and then this distress, and you're not really able to like your lungs are not able to like expand properly, like even down to alveolar level. The little alveoli are not expanding on their own, so just not exchanging those good gases, the oxygen gases that you need for the rest of your body at that point. So it just causes like it's like this domino effect of causing other problems in your body.
And are there treatments available? Like once people have contracted the virus, or are our only options basically come up with a vaccine, try not to get it, or do we have possible medical treatments for people that have contracted it?
I mean, I don't know as a nurse if I'm allowed to like say anything, but it's mostly, I think in the U.S. nothing has been approved as treatment. Like any sort of medication or drug has to be approved by the FDA.
Right.
It does sound like, from just what little research I've done, is that multiple countries around the world are trying to either develop a treatment or test different medications to see if this virus responds. And then other countries are also trying to develop a vaccine, but it just takes so much time, and it's just such a high risk thing to like test new medications or on people during this time. So right now, no, it's more like a treatment in the hospital. If you get to a hospital level treatment, it's more respiratory support, hydration. If you do end up needing antibiotics for any other bacterial infection you may have, that kind of thing.
And again, I'm just asking more. You are not brought on here as a person that's giving direct medical advice for people. You are not. I'm not bringing you on here to tell people exactly what to do. I'm just more so want to give some information to folks that we normally can't really get to in normal news media, because like they're shorter amounts of time periods for the interviews. They are focused on certain elements for their viewers. Would you? What is, from what you can tell, what actually causes the mortality? Is it just literally an inability for the body to get oxygen, so other organs shut down? Is it the body's going septic? Is it the actual virus itself occupies too much cellular space or something like that? Like, what is actually killing people?
I think it's when people are going into respiratory failure, and if your lungs are not supporting the rest of your body, yeah, it's when other organs start shutting down. And I think people, from what I've heard, people are going into like either a respiratory arrest, or their heart is starting like stopping after a while.
Okay. Wow. So I'm going to ask you a question you don't have to answer. This one is just something I'm wondering. Does this make sense, or like, are you familiar with any other illness that has spread so quickly and so far around the world? Does it make sense that this came from bats in a market in one small area in China and made it this far around the world this quickly?
Oh, yeah, I don't think I have a good answer for you. I really don't know.
Okay. Is this an alarmingly fast or rapid spread of a viral infection, or is this like kind of a normal kind of spread for a contagion of this type?
Um, I have just very little experience with infectious diseases. I did a little bit of work with measles recently in Samoa, and that is actually a pretty fast spreading disease, and that usually affects children with complications more so than older adults. And that does spread quickly, but it seems like, we've had a vaccine for that for quite a while that's been approved around the world. And so that's what we did in Samoa recently to help contain that. And it seemed like, within a few months that was contained pretty well. It wasn't really spread to other countries or anything. I've also had some experience with TB, and TB people are still so scared of when they hear about it. It's very stigmatized, and everyone thinks that that's extremely contagious. When in reality, it can be kind of hard to get. I have not seen TB spread as fast as this coronavirus. I have not worked with like SARS in the past or MERS in the past, or like Ebola even. I think Ebola would have been maybe another comparison for how fast this is spreading. But yeah, at least in my lifetime, I've never seen anything spread so fast as this coronavirus.
Wow. Okay. Well, is there anything before we depart? Is there anything that you would like to tell people, or any message you would like to leave folks with before you head off?
Just the whole like social distancing. I know it's like being ingrained in our heads, and we're making jokes about it and memes and funny things like that, but it really is just so important. You just don't realize, like, having a friend over, like, they might be in contact with other people who don't have like good immune systems, or other people who have health problems who might be more at risk of having complications if they do get this coronavirus. So like, I know it's so difficult to stay at home, but try so hard. Like, this is when we're asking you to do the very least. Like, don't do much right now, and you can help the most, you know? So do your very best to, like, eat healthy, drink lots of fluids, wash your hands, and stay away from people. Try to connect with them in different ways. My friend is having a baby in the next couple of weeks, and I've already told her I'm going to do drive-bys and like try to see her baby through a window just to be super safe, like, if it's what it takes to keep everyone healthy and safe, like, do it.
Okay. Well, thank you very much. Shout out to Laura. I appreciate you coming on to the cast and sharing some of this information. And shout out to all the healthcare workers and people that are on the front lines with this stuff. Hopefully, this information will help people at home that don't trust big media, that think this is a hoax, that think the government. Oh, last question. Do you think the government and medical professionals are overreacting, underreacting, or reacting appropriately? Do you, like, because I'm running into folks that think this is just scare tactics and that this is some hype. I'm running into other people that are like, no. I've talked to some healthcare workers that are like, the government's not telling you how bad this could be. So where do you think we're at with all this? Do you think it's kind of an accurate portrayal?
I mean, coming from the healthcare like standpoint, I think, like, any stories that you hear from doctors and nurses and respiratory therapists themselves, like, those are the accurate portrayals. Like, I mean, I'm not like in the financial world or in economics or anything. So, and I honestly have not like looked into all the conspiracy theories going on right now. But from what I see in the hospitals right now, like, this is very real and very scary with how fast it's spreading and how bad it can get in even healthy people. So, accurate portrayal, just, I guess it depends on what news outlet you're looking at and who you're listening to.
Okay. Well, no, that makes sense. Well, I appreciate it. Thanks a lot. And I hope you and friends and family and everyone out there is safe.
Cool. Thank you. You too. Good luck, Chris, with all your family and friends. And thank you for spreading the good words and advice.
Hopefully it helps some people. And so I'll be in touch. I'll definitely give you a call, and we'll chat when we're not on public broadcast and catch up.
All right. Sounds good. Have a good day.
All right. Peace.
Bye.
All right. So that was our final guest. My friend who is a nurse out in California and in Hawaii, going by the name of Laura. Thank you for the information. I'm going to sign off. This is Chris. You can see my account is Parn Hash. Follow me, friend me. We're going to be broadcasting over the next couple weeks, the next couple months, and hopefully I'll be able to set up a schedule. I'm going to get into the groove. I'm going to figure out the sound on everything. I'm going to figure out the technology, and we're going to be ready to rock. This is going to be your source for information that is not tied to any major corporation. It's not tied to any political party. You can get this information from me knowing that there's nothing influencing it besides what I believe is the truth. No one's paying me to say anything. I don't have any advertisers, any sponsors. This is all out of love and personal interest and me wanting to learn and share information with people. And yeah, I hope it helps. Y'all be safe. Peace.